Decode communication I am discussing in this video, that is common 2021. That is a 10-month, the task is that 10-month-old infant with 36 hours of diarrhea and vomiting, diagnosed cases gastroenteritis, most probably caused by rotavirus. Then he was admitted to the hospital until he improved and he went home. Okay, he came back with the severe abdominal pain and recurrent jelly stool. Okay, red current jelly stool. So red current jelly stool, ultrasound shown intrasusception. Talk to the mother via video to tell her about the transfer to the regional center. So transfer that to the regional center. Question was that why bilious vomiting? Why did you discharge him without diagnosing this intersusception? What will you do for my baby? Will he need surgery? I want to go to another hospital. I want to complete. So as usual, we are starting with IRCAP, introducing myself, Repo, taking the constant agenda, attendance and prior knowledge. So hello, Mrs. Saput John, Mrs. Johnson. Hello, doctor. I am Dr. Emma, one of the doctor here. I guess you are Ali's mother, isn't it? Yes, that's me. Ma'am, it is really my honor to sit with a keen ma'am like you. Ali is lucky as he has you in his life. Fine. Ma'am, I am here to talk with you about Ali's condition. Do you need anyone to be here or shall we start? No, doctor, please start. Okay. Can you tell me about Ali's conditions? He is having gastroenteritis and you discharged me with open access card and now he is having intermittent tummy pain. I am really worried about him. So we have discharged yesterday with gastroenteritis. Now she come with tummy pain, mother is telling. I do understand how do you feel and I'm deeply sorry to tell you that the jelly scan has shown that he has a condition called intersusceptions. I'm really deeply sorry for that. So we tell that I'm really deeply sorry for that. Our voice should be empathized because we are giving a bad news. What is that? Did you hear about it before, ma'am? No, I did not know what is that. Can you please follow me at this drawing to make myself clear? So we draw pictures that is normal intersusception. Another is inside the intestine, telescope-like structure we'll draw. So imagine with me, this is his mouth and this is the food tube. Then the stomach and then the gut and the back passage. There is a part of the gut get telescoped inside each other and obstruct the blood flow to the part, preventing it from doing its function. So what happened? The picture is that we will mouth, then food pipe, then stomach, then the gut. What happened in the gut? One side of the gut enters into the other side, give a telescope appearance, and it prevents, it obstructs this blood flow and preventing it from doing its function. So what will you do for him? So what is the management plan for intersusception? We have, first of all, we will admit to the hospital now, put a tube from his nose to his tummy to remove any excessive secretion from his tummy. Also, we will not feed him by his mouth at all. We will give him IV fluid and correct any salt disturbance in his body. Am I clear? So first we will give him not food in his mouth. We just a tube will enter in the mouth and all the secretion we will take out and we give the fluid, and if there is salt disturbance, we will according to his condition. And then the X-ray doctor will try to push some air through this tube from his back passage area, hoping to push this telescoping part to its normal position. If this not work, we may need to do open surgery to regain the normal shape of the foot tube. So first, the X-ray doctor, he will push some air from the bottom of the child, hoping that the telescoping part of the intestine will be in normal position. If not, then we need to do surgery. Okay, doctor, I want to know why he is not admitted yesterday. We were here yesterday. So we know that yesterday was gastroenteritis and we discharged. So actually we did not admit him yesterday because his condition was mild. He did not need any admissions. He was given open access card as well. Also, we do not admit the children unnecessarily for fear of catching bugs. And I'm really sorry to tell you that this what happened is unpredictable. Even he is admitted, he could have this condition as well. There is nothing in our hands to prevent it from happening. So we don't admit because the condition was not that now first, and there is no indication for admissions. We unnecessarily we are not admitting anyone because of catching bugs. And if we admit this child yesterday for the gastroenteritis, then still develop this condition. It is an unpredictable condition. We'll tell that. You do not admit him because we are Arabs, ma'am. I'm really sorry to get this impression. I'm really sorry that you get these impressions. But we are treating all our patients equally, regardless their age, religion, and other ethnic group. No, I wanna take him to another hospital. I do understand your feelings, but Mrs. Johnson, but this is the best hospital for him. He is familiar with the staff, and we are familiar with his conditions. Are you preventing me? Definitely no, but let us stabilize him first, and when we can then we discuss with the consultant that I will complain Then I have mentioned there is nothing in our hands to prevent from happening. No doctor, I will complain. This is right. I will guide you through the patient advice and liaison service. So when mother tell that we need to go another hospital, we tell that it is the best hospital for you. He start familiar with us. We are also familiar with him. The common line. Then tell I want to go another hospitals that it is unpredictable and also we need to talk about the consultant about. So again, mother is forcing. They will tell that it is your complete right. I will guide you through the patient advice and liaison service pulse. Then any other concern, summary, trusted website, retail leaflet, support group. So this is all about gastroenteritis first, then develop intersusception communications. Thank you very much.